My name's Dr Sarah Gutman. I'm Head of Cardiovascular MRI here at the Baker Institute and also a postdoctoral research fellow in the Cardiometabolic Health and Exercise Physiology lab. I have two main areas that I research, and I guess the underpinning theme is in the cardiac MRI tissue characterisation. So what I was really looking at in my PhD, but in different conditions. The first condition is called heart failure with preserved ejection fraction. That's when there's heart failure, so there's not enough blood supply to meet the body's needs, but the actual heart pump works okay. It just doesn't relax well. So when people think of heart failure, they think of a weak muscle, a weak pump. This is a pump that works, it just doesn't relax, and when it can't fill, the end effect is the same. The body doesn't get the blood supply that it needs, fluid builds up, and the patient experiences the symptoms and signs of heart failure. One of the main risk factors and causes of this condition is obesity, another epidemic that's really taking over, especially in the developed world. And then my second area of interest, and as I said, that it doesn't sound like there's a great link, but the link is really the MRI, is in a genetic condition called desmoplakin cardiomyopathy. It's quite newly described, and I like to look at predictors on cardiac MRI of this condition. We never really had any treatments for heart failure with preserved ejection fraction. It was all concentrated in the heart failure with reduced ejection fraction space. And now that some treatments are coming out, it's very important to understand who qualifies for them. And if we can use cardiac MRI as a way to differentiate that, I think that will be revolutionary and also very cost saving and save patient distress so they don't need to undergo invasive tests. My short-term goal for the desmoplakin patient is similar. It's really to understand which patients are at risk with cardiac MRI to get the right patients genetic testing promptly and get them managed comprehensively. Where I'd want research to get to for my heart failure patients is for it to be a lot more precise and personalised than it currently is. I'd love to be able to say to my patients, for your gender and your age and your specific condition and your stage of life and your symptoms, this is the exact treatment that you need. And I think we can do that a lot better in heart failure. And that's what I'm working on in my obesity work, even for that subset of patients, to be able to say, these are your exact problems and this is the treatment that you need. I can't say enough how much I love the Baker Institute. From the moment I started my PhD here, and I kind of fell into it a little bit, so I'm just so grateful that I did, because there's always been an expectation and an understanding that I'm a clinician and that I also have clinical work, and that informs my research. Patients are what makes me want to answer the questions,